Okay, so now we're going to talk about the general survey, measurements, and vital signs. So the objectives is the initial survey, assessment, the general survey, which entails appearance, behavior, body structure, mobility, and also we're going to go over vital signs, including the pain assessment. Okay, so let's take a look at this hospital room. Tell me what you're observing. What do you observe? What details do you see while you are looking at this brand new, clean hospital room that's waiting for a patient to come and be admitted? What do you see? What are some specific details that you find important? Take a moment and just take a look. Now, let's look at this next page. What do you see here? What do you see? What do you see in this sweet little lady? Okay, now going back to the components of the general survey, you have what again? Appearance, mobility, behavior, and what else? Body structure. So how would you document your observations here? What do you think of her physical appearance? Looking at her age, her gender, the color of her skin, how's her level of consciousness? Is she looking at you? How's her affect? How's her facial features? Is she in signs of distress? Looking at her body build. How's her height? How's her weight? Nutritional status. Just by looking at her, you can get a lot of detail from that. Posture. Is she in kyphosis, lordosis, scoliosis? What type of posture is she in? Now looking at her mobility. So it appears that she's using maybe a walker. How's her gait? Her movements? Range of motion? Her behavior. So looking at her behavior, what do you see? So facial expression, how's her mood and affect, her speech. Okay, we can't really tell with her speech, but also how is her hygiene, her dress, her grooming. Looking at all these factors, you can get so much information just by looking at her. So let's talk about the initial assessment. Just by walking into your client's room, you're going to be able to tell how's their level of consciousness, because you're going to start thinking of these certain questions. Are they alert? Are they making eye contact with me? Like we talked about it last week, when I walked into the room, you guys automatically looked at me up and down. You made eye contact with me, some of you, but you initially looked at me. And I scanned the room, and I'm like, okay, is anyone looking down? Who's looking down? Who's looking at me? Who's not looking at me? Okay, I scanned the room. I'm immediately doing my initial assessment of the classroom. Okay, then when you're looking and talking to your patient, you're going to determine, are they oriented times 1, 2, 3, or 4? Now, what does this mean? It means is the patient oriented to person, place, time, and situation. Then we're also going to do an assessment of their Glasgow Coma Scale. So we're going to assess their alertness, their motor, their eye movement, their speech, so commands, and we're going to talk more about that in class, and I have a handout for you. So general survey characteristics. So the general survey is a study of the whole person. It looks again at their appearance, their behavior, their body structure, and their mobility. So a general survey encounter, when does it even happen? This is kind of redundant, but we're going to go over it again. It's when you first meet the person. You're launching the general survey right when you meet the person. So what leaves an immediate impression? So if we go back to that woman with a walker, what was an immediate impression that you got from her? Me, personally, I got that she seemed pleased, or that she seemed comfortable. Her dress was appropriate for the situation. She was indoors. She looked comfortable. Her mobility, can't really suss that very much, but she was using a assisted device. She was using a walker. Does this person stand promptly as his or her name is called, and do they walk easily to meet you? Same thing with shaking your hand. Okay, not every client is going to get up automatically, but you can reach out your hand and you can determine a lot also from the handshake. How strong is their grip? Are they able to meet the hand? So does the person look sick, rising slowly or with effort, with shoulders slumped, eyes without luster or downcast? These are all questions to think about. A hospitalized patient, are they conversing with visitors? Are they involved in the reading or television? Or are they just laying perfectly still? Just by observing the client, you're getting all this data. So again, even as you introduce yourself and you're shaking hands, you're collecting so much data. Does the person fully extend their arm, shake your hand firmly, make eye contact, smile? Also, are the palms dry or are they sweaty? Yeah, are they clammy, wet? All this data you're collecting. So again, the 4 components of the general survey: physical appearance, body structure, mobility, and behavior. So let's look at the physical appearance. So age. Does the person appear his or her stated age? So looking at this picture, on the left is the current picture of the woman. Then they modified it. So aged non-smoker. Okay. Maybe 50. Okay. The first picture maybe in her 30s. Then the second picture maybe in her 50s. But then it shows, okay, she's a smoker. And it shows you the difference. Shows you the difference if they're starting to smoke. So when I'm looking at this, okay, if I come into the room and I automatically see the picture of the client who's aged smoker, but I don't know if they smoke yet, I'm going to start investigating in my interview process. I'm going to start asking questions. Do you smoke? Do you drink? And then once I find out that they smoke, it's all going to come together. And I'll be like, oh, that's why they look older. Okay. They're not as their stated age. Sex. Sexual development appropriate for their gender and age. Their level of consciousness. So the person's alert and oriented and they respond to your questions or they attend to your questions and respond appropriately. The skin color. Their color is even. Pigmentation varies, okay, with different genetic backgrounds. And their skin is intact. So taking a look at this picture, let me take me off. There you go. Taking a look at this picture, what's the difference between those 2 hands? Okay, one's a little bit more yellow than the other. Facial features. We're looking at, do they have symmetry in their movement? Do they have symmetry when they smile? How's this gentleman? He's smiling, but is he symmetric? No, not at all. He has a droop on the right side, a right facial droop. Also, we're looking to see, do they have any signs of acute distress present? All right, so the objective data I can gather from their behavior. Facial expressions. Do they make eye contact? Unless they have some cultural considerations that they don't look at the eyes, they don't make eye contact because they either think it's aggressive or rude. How's their expressions appropriate to the situation? So let's say it's a mom that just lost her baby at 10 weeks. No, let's say 30 weeks. She's laughing. She's laughing about losing her baby. Is that appropriate to the situation? No, it's not. Okay, so note the expressions both while the face is at rest and while the person is talking as well. Mood and affect. The person is comfortable and cooperative with the examiner and they interact with the examiner as well. How's this patient's mood? How's her affect? I would say it's pretty flat. No expression. It's a flat affect. Their speech. Are they able to articulate the words? The ability to form words. Is their speech clear and understandable? So a stream of talking is fluent with an even pace. So they're not just talking like in a million miles a minute, or are they just talking really slow and slurring their words? You have to take those into considerations because maybe there's a reason why they're slurring their words, talking softly, or they're talking a million words in a minute. Okay, we have to take those all into consideration and document our findings. Their ideas are coming out clearly. They're able to convey ideas clearly. Their word choice is appropriate to culture and education. They're able to communicate easily for him or herself with or without the interpreter. So more behavior, dress. Their dress is appropriate to the client. So let's go back to the woman in the front. She was indoors. She looked comfortable. She looked like she was dressed appropriate for the situation. I don't know the situation, but she's indoors. She wasn't wearing a bikini. She wasn't wearing a swimsuit. She wasn't wearing a big old snowsuit. Because you could see in the background, there was 2 other people in the background. They were dressed the same. So also, do they look clean and they fit, and the clothing fits the body, and they're appropriate for their age. So example is Amish women wear clothing from the 19th century. That's appropriate for them. Indian women may wear saris. Cultural determined dress should not be labeled as bizarre. Okay, it should not be labeled as bizarre because everyone's different. Now, you won't know what their culture is until you start interviewing them. But initially, you're going to note this, but then once you determine their culture, then everything's going to come into play, and you'll understand why. Personal hygiene. The person appears clean, groomed, and appropriate for his or her age, occupation, or social economic group. Now, how does he look? He looks spiffy. His hair is wild. He has a nice fro. How's his affect? How's his dress? He looks appropriate. He looks like he's in a courtroom, honestly. He looks appropriate. Okay. How's his grooming? It's okay. I mean, it's appropriate for... I'm not sure, actually. So, looking at him, it's not typical to see someone who has a huge fro like this, right? But we have to investigate a little bit more. So this is our initial general survey assessment. We'll collect this data, and then we'll collect the subjective data as well. And then that's when we're going to analyze all the data that we have, and then we're kind of like going to cluster that data. So, but he doesn't look too appropriate for the situation, especially for his age, and he looks like he's in a courtroom. So there's all that. Okay, body structure. So, stature. The height appears within normal age and genetic heritage. How is her stature, her height? It's not within normal range. Right. Symmetry. Body parts look equal bilaterally and are in relative proportion. How's this? Proportional? No. This one here, let's get this. He has atrophy. Okay, muscle wasting in this right leg. They're not equal. You must note that these are not equal. So document this. Posture. The person should stand comfortably erect and appropriate for age. Exceptions. So standing toddlers, okay, they'll have that lordosis. So if we see a toddler, okay, if no one's ever seen a toddler, they kind of have that belly out. Where if it's an older adult, they're going to have that kyphosis, hunched over, older adults. So the first one you'll see is a normal stature, okay, normal posture. Then you have scoliosis. This is a picture of scoliosis here. When they're curved, their vertebrae is curved. Then kyphosis, they're going to, towards that thoracic spine, in between the shoulder blades, they're going to start being hunched over. Now, lordosis, they're going to have that belly out. Pregnant women have this, toddlers have this. The position, are they sitting comfortably in the chair or in the bed? Are their arms relaxed? Their head is turning towards the examiner. Are they comfortable? How does he look? Does he look comfortable? I don't think so. How's his nutrition? So this gentleman looks like he has COPD. which is a chronic obstructive pulmonary disease. And he looks like he's been struggling to breathe. Okay. Now with this, when he's feeling really short of breath and struggling to breathe, he's not going to be very hungry. So he's losing weight. He's in a tripod position when his arms are out like this and he's in this tripod position. This is actually going to help open up those lungs more. Open up those lungs, be in this comfortable position to help him breathe. I would not say he's sitting comfortably in the chair. I would say he looks like he's in a little distress. Their body build, their contour. So arm span. Fingertip to fingertip should be equal to their height. Any obvious physical deformities. So it could be congenital or it could have been from a soccer game and they have a left elbow deformity. Okay, we must note that. And then we also are going to assess that area specifically for any abnormalities. How about this? Is this congenital or like an acquired defect? Okay, this is congenital, yes. And I'm going to note this. Okay, so gait. So normally the base is as wide as the shoulder width. Foot placement. Is it smooth walking, even, well balanced? Are they symmetric arm swings? Range of motion. Are they able to move the arms with full mobility at each joint? Or is there no involuntary movement? Are they unable to move that side, and why? Did they have a stroke on that side, and is that why they can't move that arm? So now let's just briefly talk about vital signs. We are going to do some concept maps in class on vital signs, but we're going to talk about weight, height, BMI, pulse, blood pressure, temperature, respirations, and pain. So measuring weight, we're going to instruct the person to remove his or her shoes and all the other heavy clothing prior to standing on the scale. It is ideal for them to just be wearing the same outfit every single time they take their weight, especially for patients who are on fluid restrictions or if they have a chronic disease that they have to weigh themselves pretty accurately every day. So I tell them, if you want to wear your birthday suit, just wear your birthday suit. That's totally fine. So same time, same type of clothes worn each time when they have to do repeated weights. And when they come in, so let's say you're working at a PCP office, you want to compare their weight from their previous visit. Okay, so weight gain could reflect from an overabundant caloric intake, unhealthy eating habits, sedentary lifestyle, or it honestly could be related to fluid. There could be lots of fluid on them. Can we estimate their weight? Can we estimate their weight? No, we can't. The reason is because medications are a lot of times are weight-based. There's a lot of medications that are weight-based. Not every med is weight-based, but a lot of medications are, and it is imperative that we get an accurate weight. So height. So the person should be shoeless, standing straight, looking straight ahead with their feet and shoulders on a hard surface. Again, can we estimate weight or height? No, we can't. The BMI, so this is a good indicator for obesity. So here's the BMI scale. So underweight is less than 18.5. Normal is 18.5 to 24.9. Overweight is 25 to 29.9. And obese is greater than 30. Okay, so now we're going to assess the client's pulse. We're going to be gathering their rate, rhythm, quality, and strength. We're using our finger pads. If we find that their rate, rhythm, quality, okay, or anything is abnormal, irregular, we must perform a pulse deficit. What is a pulse deficit? A pulse deficit is when you have one nurse listening, auscultating the apical pulse, and then you have another nurse who is feeling the radial pulse. They are both counting for 60 seconds, and then they compare their findings. So here's a pulse ox, okay, so this determines the oxygen and it can give you the heart rate, but the best best way to get the heart rate is actually manually. So using your finger pads at each location. So here's the manual. So this is when they're using 2 finger pads to feel for the radial pulse. Blood pressure. Okay, so you're going to need the blood pressure cuff, okay, and a stethoscope. So how do you get blood pressure and what is it? It's the force of blood against the walls of the artery during systole and diastole. So these are the expected ranges, okay? So the systolic should be 120 and the diastolic should be less than 80. And then it takes it even higher. So pre-hypertension, stage 1, stage 2. Now, stage 2, if they have hypertension with 3 separate visits over a period of weeks. So that's when they would get into stage 2. And that's when they would actually be determined that they do have hypertension. Hypotension is low blood pressure, and this is when the systolic is less than 90. So let's go over the factors controlling blood pressure. So the first thing I would like to look at is vascular resistance. So vasoconstriction. So an increased resistance. What does it mean by vasoconstriction? So that means the vessels are constricting. They're getting smaller. So as you see here, automatically, right here, let's highlight it. Right here, the vessel is open and then it starts constricting. So what's going to happen with that blood pressure? The blood pressure is going to rise. Now, if there's a vasodilation, okay, so a decreased resistance, the vessels are open and then they start dilating. So they open up more. Right here, see how they open up? So the blood pressure is going to decrease. Now let's look at volume. So if there's a decreased volume, so such as if a patient has a hemorrhaging, okay, so if the patient is hemorrhaging and they're losing volume, possibly it could be from a surgery, maybe they got cut, severely cut, and that's going to cause the blood pressure to drop. Now, if they have an increase of volume, so such as an increase of sodium and water retention, or if they're just intravenous fluid overload, okay, what's going to happen? Their blood pressure is going to rise. Okay, it's going to rise. So they have an increased volume. So that's how you read this. So I'd like you to look at the rest of this and just kind of say it out loud. Okay, so if you don't know what any of this stuff means, so like this part, we're going to talk about this in class a little bit more, but make sure you look this stuff up. So if there's words that you're like, I don't know what resistance means, or vascular resistance, or vasodilation, please make sure you look it up. Okay, so temperature. What equipment are we going to use? We're going to use a thermometer. So the temperature is the balance between heat produced by the body and the heat lost to the environment. So influencing factors, so such as increased hormones, menses, menopause, exercise skin, dehydration, when you're ill, when you're stressed, could be just the environment. Now, influencing factors that can decrease your temperature could, again, the environment. And surgeries. Surgeries can decrease your temperature. Respiration. So equipment that is needed. A watch with a second hand. So you're going to count for 30 seconds and then you're going to times it by 2. The best way to do this is if the client doesn't know you're doing this. So when you're getting the heart rate, after you've gone the heart rate, times it by 2, document it, go back, feel for the heart rate, but you're only kind of distracting the client because you don't want them knowing you're counting the respirations. Because if they know you're counting the respirations, they're not going to breathe normally. They're going to start or not breathe at all because now they know you're watching their breathing. So the accepted range is 12 to 20 breaths per minute. And then you're going to assess their depth. Is it even, quiet, regular breathing pattern? How's their rhythm? Is it regular or irregular? Are they labored? Okay, there's so many different abnormalities, and we're going to talk a little bit more in class with a concept map. If irregular, okay, you must count for 1 full minute. Anytime you have an irregular rate, you must count for 1 full minute. Anytime you have anything irregular, you must count for 1 full minute. So now we're going to assess your client's pain assessment. So this is subjective data. So if the client says they're 9 out of 10, you're going to document 9 out of 10. But you're also going to document their objective data. What are you observing? Are they laughing? Are they crying? Are they hunched over? How is their position? How is their appearance? You're going to still chart all that objective data because it tells a story. It does the presentation of how the patient presents during that time. Now, here's an example of when you are going to be using your nursing judgment and your clinical reasoning. Okay, so you have a patient who is kind of nodding off, they're kind of sleeping, but they call you. They say, hey, I'm in a lot of pain, I'm a 10 out of 10, but they kind of just like nod off. Can I have some pain meds? Okay, so what am I going to do? I'm going to report to the doctor and I'm going to document. The patient is reporting 10 out of 10 in a specific location. I'm going to document the quality of it, everything the patient just stated to me. Now, if the doctor goes, well, what would you like to give her? Okay, well, then I'm going to give the doctor also my objective data. Well, I just want to let you know that the patient is nodding off while they're assessing or while they're talking to me. The doctor can put the 4 milligrams of morphine in, which is a narcotic. That's fine. But I'm going to use my nursing judgment to determine, is this a safe nursing action I should do at this moment? Or can I do something else that's safe? So it kind of goes back into the safe and risk reduction from 215. Okay, I'm going to look at the safest route because if I give this narcotic for this patient, I can actually deprive them in their respiratory drive. So I don't want to try and chase their oxygen or their respiratory rate because it's going to start decreasing more after the narcotic. So I can do some different nursing interventions to help their pain. So that's when you're going to use your nursing judgment is, okay, you have to assess your client. Are they awake enough? How is their pain? Are they able to talk clearly with you? I understand that their pain is a 10 out of 10, but is it safe right now for me to give them this medication? Think of all that stuff. Now let's talk about older adults. So older adults with a general survey, their physical appearance. So by their 80th and 90th years, their body starts doing this proportional redistribution. So they're going to have more adipose tissue in their abdomen. Their facial features are going to be a little bit more angular. Their body contour is sharper. So, and also their posture, they're going to get that kyphosis position. Okay, what is kyphosis exactly? What causes it? So it's degeneration of the vertebrae. Okay, it comes with age. Now, not every adult will get kyphosis, but it's a possibility. So their gait is going to be a little bit wider, so their balance can be a little off. Their steps are going to be shorter and even. And again, their weight, the adipose tissue, is going to get more distributed to the abdomen. Okay, so you can look at these, but we're going to do these in class.